Hi, my name's Sue Schulke, and I'm faculty member here at the College of Nursing Lincoln Division, the University of Nebraska Medical Center. And the title of my project is Heart and Seek, Cardiovascular Medication Escape Room. Dr. Tiffany Hunt will be also a sponsor on this project. She teaches pathopharmacology to our undergraduate BSN nursing students, and she has them in Pathopharm 1, 2, and 3. And I have them in their foundational patient-centered care course. And we are both very interested in cardiovascular disease and in medication management. So the purpose of this project is to create an interactive educational game using an escape room in an immersive virtual reality format. And we wanted to be on our cardiac medications for healthcare workers, specifically to start with for our nursing students. Classifications that we would want to cover. So in one room, we would cover beta blockers. In another room, calcium channel blockers. We do ACE and ARBs in another one, anticoagulants, diuretics, and dilators. There are hundreds, if not thousands, of cardiac medications, and we just kind of want to focus on these classifications. And our purpose is to educate the student nurse, but hope that we could use it with any other healthcare team member. And our ultimate goal is to save lives. So why is this important? First of all, heart disease is the leading cause of death in men, women, and most racial and ethnic groups in the United States. If you want to put that into perspective, one person dies about every 36 seconds. There are 659,000 people in the US that die each year. That's a lot. That's 1 in every 4 deaths. And medications are a key component in managing and treating heart disease. But medications are without risk. The FDA receives over 100,000 reports of medication errors every year, and up to 10% of hospital patients may experience a medication error during their stay. You may know somebody that had a medication error, or maybe yourself. Medication errors are linked to at least 1 death every day in the US and injure about 1.3 million Americans each year. Even at home, errors like a missed dose, incorrect self-administration, can have deleterious effects. And some of that is due to the education that maybe they receive from their healthcare worker. They're a significant economic impact. They cost over $40 billion annually in patient care and $21 billion in preventable errors in all care settings. So whether it be hospital, home health, at home on their own, long care facilities, they can happen anywhere. And there's more. As patients get older, as the communities get older, a lot of times patients start to take more medications. They have more cardiovascular disease. They have more comorbidities like diabetes, which can really affect heart disease. And adverse drug events are the leading cause of emergency department visits. And one of those that we'll be talking about is anticoagulants. So they are very high risk. So what we want to do is invest in reducing patient harm. It will save lives, have better patient outcomes, and actually have financial savings. So why do I think nursing education is important? Because nurses are the last defense for these patients. So let's take a hospital situation. Patient's in the hospital, maybe physician's been up all night, he was on call, he writes a dose, inappropriate dose. It gets through the pharmacy, goes up to the nurse actually gives the patient the wrong dose because the wrong dose, maybe it's too high, maybe it's too low, was ordered by the physician. And if the nurse doesn't recognize that and pick that up, patient can have a bad effect. We need to know interactions. So if I have maybe a pulmonologist on a case and a cardiologist and an oncologist and an internal med, and they're all writing to their own specific specialty, there may be interactions with those drugs. Or maybe the patient comes in and just tells the nurse and doesn't tell the physician because they're embarrassed that maybe they're feeling lightheaded and they're taking these medications all at once instead of maybe taking half the meds in the morning and half in the evening. So we need to know interactions. We need to know, are there medications that cancel each other out? And there are. They need to know specific side effects. One of the things we don't want the patients to feel worse on a medication, but maybe they were taking a medication, and I'm going to use our ACE as an example. One of its side effects is kind of a dry, hacky cough. And if the patient doesn't realize this, then they may think they have a respiratory problem, or maybe the side effect is so severe that they decide to quit taking that medication, and they don't know that we could adjust the dose, that there's certain things we can do to help with those side effects. The nurse has to know what to monitor. Do they watch blood pressure? Are they watching heart rate? Is there a certain lab value that we need to keep in mind? Are there signs and symptoms like muscle weakness that we need to know about to educate the patient so they know maybe when they might have a medication that's not appropriate for them? And we don't know that until the patient takes it. And what about dietary interactions? We send patients home and then we say, well, don't take this med with grapefruit juice, or don't take this medication if you have an empty stomach, or, oh, you have to take this medication on a full stomach. It's better absorbed if you do that. Take this at this time of day. It's going to act better because of your cortisol levels or your circadian rhythm. So there are certain types of things within the environment that we have to educate our patients on so they know what to do when they're at home. And they need to know how to administer it. I mentioned taking it on an empty stomach, taking it when the stomach's full. Do they take it in a liquid form? Can they crush a sustained release medication? There is so much the nurse needs to know so we can also educate the patient on. And if we can figure out how to educate nurses better, we can help decrease some of these effects errors that are going on with medications. Now, to simplify that, we want to know, how do we educate better? And one of the ways we can educate better is to make things more interactive. Sorry, I cut my little E off there. And one of those ways is to make education more immersive, more interactive, use our imaginations, get both sides of the brain working, and we can do that through gaming. And one of the games that we're experienced in is immersive virtual reality. We've used it in the classroom, we use it in the simulation lab, and we've seen great educational outcomes with this. So what do we have available for you? We use Meta 2s, 3s, and 3Ss with our students. And you can see an example here of one of our virtual reality labs. They're all taking care of a patient within that headset. We have workspace that we can use. If you need to have meetings here, what I've done in the past, and I've worked with a number of different computer science and engineering senior design students, we have applications in Curio, which is a company that provides IVR free education. We have things on SideQuest. We've had applications on itch.io. So know that your work will not just sit on a shelf, but it will be used. So our experience, our facility, we can have meetings here. We can do a lot of meetings on Zoom. We are on campus. We are on the east edge of campus, just kind of south of the Beetle and by the East Side Suites here. We are the building that looks like a boomerang. And I can get your IDs programmed for the college so you can get in and use workspaces here if you would like. So we do have facilities. We are familiar with IVR, and we do have headsets that we can use. So in conclusion, if you're interested in serious gaming in healthcare simulation, if you want to be creative, because we have ideas that we can use for games, but they are never as good as what you guys come up with. I love working with senior design students because you guys know what your age group uses for gaming. I didn't know what an Easter egg was until somebody started hiding things in games, and I love that. I want you to be creative. I want you to come with ideas. I can give you information. Dr. Hunt will give you information on the medications and some of the things we want, but then I need you to be creative. This is a project that will impact lives, that we can use IVR to better educate health professionals. And the bottom line then is we have better patient care and we save lives. So please join us on this important project. If you're interested in gaming, if you're interested in having fun and being creative while we do serious work, this project's for you. So thank you. I appreciate your time.